And welcome back. Well, you probably heard the phrase, I laughed so hard, I peed my pants. It means something is really funny, but what's not so funny is that it's a real problem for so many women. If you leak when you cough, sneeze, or jump, it's definitely no laughing matter. And joining us now is Dr. Sumana Koduri from SAAK Health today, and we're talking about Emsella. I just want to make sure I'm saying that right, for urinary incontinence. And good morning, and thank you so much for being here. First of all, talk a little bit about this problem for women and it being such a taboo topic that we sometimes don't even address it.
Yeah, I mean, we've talked about this before, where 20–30% of the population has urinary incontinence. It could be with coughing, sneezing, laughing. It could be with I gotta go, you know, those gotta go commercials. Can't make it to the bathroom in time. The usage of pads, trying to just live their life.
Yeah.
But it's impacting their quality.
Yeah, and oftentimes we kind of just think, oh, when something happens to us, it's just getting older or it's just what's happening to my body, and you never really get help. But you're saying that their help is on the way. You are here to help us. And that brings us to this chair that we've been talking about all morning and this procedure. It's Emsella.
Emsella,
and this is a unique chair that helps strengthen the pelvic floor of our bodies.
Right. So we're trying to strengthen the pelvic floor muscles. A lot of pelvic floor defects, incontinence being one of them. People talk about my bladder's falling down, even pain, those types of things. But this is really for incontinence, also can be used for sexual health. So there's plenty of things that we can use this for, and what it does is it is focused electromagnetic stimulation to the perineum, the pelvic floor muscles.
Oh, wow.
So when this machine is on, and we're going to turn it on in a minute, when it turns on, it's kind of doing those Kegel exercises that we talk about so much.
Yes.
So it's helping those muscles contract. It's kind of like a TENS unit, but it's external.
It's external, and because those Kegel methods sometimes they work, but they're not effective enough. So this is probably a stronger boost, yes or no?
This is a stronger boost. It is. It actually delivers 11,000 Kegels in the 30-minute session that we do.
Okay. Okay.
So it's a workout.
Yeah.
You know, after the treatment, people will feel like they had a pelvic floor workout.
Okay.
It can help people who sometimes they'll say, I'm going to the therapist, they're teaching me how to do the exercises, but I'm not sure I'm feeling it properly. I'm not sure if I'm doing them correctly. Well, this helps you do them correctly.
This helps you do them correctly. And let's go to a testimonial soundbite of one of your current patients already and hear her take on this chair.
My experience on the Emsella chair, it's you sit down, 28 minutes, you're relaxed, you can read a book, non-invasive. It's good. I would recommend this treatment, the Emsella chair, to my friends, family. It's a boost when you're going through your pelvic care routine.
It's a boost. She said exactly what you just said. And we have Lori here. Lori, you have experienced the chair before. I'm not exactly sure we can turn it on today because of our power situation, but I want to kind of get your take on your experience with the chair.
Well, the treatments that I had was very comforting. It was just a tingling sensation. Obviously, afterwards you feel like you just had a workout, which is really so that the long longevity that you get from it is like you just had a workout, which is wonderful. But it's definitely not painful, and it's not discomfort. There's just it really was a great experience.
It's strengthening, and over time, this one visit, how many visits do we need to do, and over time, how does that affect what the problem is, solving the problem?
Yeah, so the treatment is 3 weeks, twice a week, half-hour treatments, like Cindy said. And they just come in. The nice thing, you can see Lori's dressed. She's not taking anything off. She literally comes, sits on this chair, and we position her properly. She has her hands on her knees, and she's just sitting with her knees a little bit wide open so that that energy can focus on that perineum. I call it the bike seat area.
Okay. Okay.
And she just sits there.
And anecdotally, do your people come back to you and say, thank you so much, doctor, or things are improving so much, or now I feel like I can, go out to dinner, be out in public and not have this problem?
I can make it to the bathroom in time.
Yes.
I can sit through dinner. I can sit through a movie. I can sit through a show.
Yeah.
These are so gratifying
Yeah,
for me
it's
to hear.
so gratifying, and quality of life is so important. We thank you so much for bringing us this chair and exposing us to this. And you have an event coming up, a launch event coming up, yes?
We do. Thank you for mentioning that.
Yeah.
We are providing demos for people who want to come in. We're going to have coffee. We're going to have hors d'oeuvres, and we're going to talk about the machine. We're going to talk about incontinence. We're going to talk about sexual health at that event, and people can try the chair.
And okay, we're going to wrap. Oh, I have one more question about, can people do this if they're not experiencing incontinence just to strengthen, or do you not even need to do that?
I guess they could.
Yeah.
They can come and pay for it. But
yes, yeah. Well,
I mean, you'd hope that you want to see something that we're fixing.
I got you. Okay. We'll leave it right there. All right.
But the event is on April 24th.
That's right. Okay, so join SAAK Health for their special Emsella launch event on Thursday, April 24th from 1 p.m. to 6 p.m. at their main office in Brookfield. It's an educational event where patients may be able to try the device, as she just mentioned, for up to 5 minutes. There will be special offers available if you attend the event. And for more information on this event or any of their healthcare services, call 262-444-5148 or visit SAAKHealth.com.